Yeah, I'm Dr. Otieno. I'm an anesthesiologist and a pain specialist. And in terms of societies, professional societies, I'm a member of the Kenya Society for Anesthesiologists, International Pain Society, and I also am a member of Plaza. At Plaza, we do specialize in daycare surgery. That means that a patient comes in the same day and after surgery goes home after we have established that the patient is able to go home. This would not be possible if we are not able to take care of pain adequately as we do in the hospital. So it's very important to make sure that pain is optimized. Otherwise, the patient is likely to be readmitted and post-operative period is likely to be very stormy. When pain is not adequately taken care of, patients have lots of complications. And those are things we would like to give the patient the benefit of, as much as we would also like them to go home the same day to save on costs. First of all, the patient whose pain is well taken care of is a happy patient. Post-op recovery, wound healing, psychological stress, economic issues like prolonged admissions are avoided. These patients also, we avoid complications like respiratory problems, cardiac complications which come around because of poorly managed pain. Even issues like infections and so on are better taken care of when you have a patient who is well managed in terms of pain. Psychologically, a patient whose pain is well taken care of is a good patient to have. The trauma of poorly managed pain is one of those long-lasting things which take patients a lifetime. Well, at Plaza, what we do is we monitor patients in terms of all other parameters. When I focus on pain, one of the things that we will educate the patient on is how to inform us in terms of their pain on a day-to-day basis. The most important thing is for the first 24 to 48 hours. If pain is managed within the first 2 days, the chances are that patient is going to do well. If pain is not well managed within those first 48 hours, the other complication the patient is going to go into is chronic pain. From that surgery, you'll have a patient who repeatedly comes to the hospital because now they have chronic pain from the same surgery, which could have taken just about 2 days to sort out. One of our main aims is to have patients who do not stay long in the hospital and they usually go home the same day. I think it's more than 99% of our patients go the same day. Majority of patients who stay because they prefer to be in the hospital. In terms of the patients we do very complicated surgeries for which patients would last even up to a week in the hospital, but they go home the same day, like total laparoscopic hysterectomy, that's removal of the uterus, which we do, and patient goes home the same day. In the developed world, like in the US, I think more than 70% of the patients of their surgery is daycare. It's the reverse in many parts of Africa. We find that more than 70% of the patients, or actually probably about 90% of surgery is done. Patients have to be admitted for a number of days for cases, for situations where they could go home the same day. And that's what we are doing here.